Joining us this morning is Professor Elizabeth Beattie, Director, DCRC Carers and Consumers. Good morning, Elizabeth.
Good morning, Phil, and thanks very much for the opportunity to talk to you about this very important initiative.
Not a problem. So, Elizabeth, what are your thoughts on the current federal and state government initiatives aimed at improving the quality of dementia care?
Well, Phil, this is a very broad question, but I think it's wise to put it in context. And one of the best contexts for thinking about this is the recent Access Economics reports from 2010. Currently, we have about 300,000 people with dementia diagnosed in Australia. But between now and 2050, we're looking at, if there's no cure found, about adding another million to that. So the issue is, even if a cure were found today, dementia is the third most common cause of death behind heart disease and stroke in this country. And when you put it in that context, when you think about absence of a cure and that people who are diagnosed do have to be cared for a considerable period of time during the trajectory of their disease, we're talking about a burden of care that is really going to strain the federal budget. We do have in this country the capacity that some other countries and different healthcare systems don't have to look at strong federal government and state government strategies. And we have had some of those in place, and these are very good initiatives. However, they do fall significantly short of what is really needed to cope with what many people would consider the dementia epidemic. Alzheimer's Australia recently called for a national plan in the federal budget. They are the peak body in the area of dementia and consumer resourcing of dementia initiatives. And their statement, read the budget, is a very legitimate and timely one, and their concerns would be shared by many people. They're talking about everybody having access, regardless of their culture and their geography within this country, to the provision of appropriate diagnosis and responsive and high-quality care, which we don't have, and certainly a major reduction in incidence and prevalence of the disease in the foreseeable future as far as is possible. And to do that, we absolutely need that national plan and a more sustained financial commitment by government to making sure that what's already been a very good start for us as a country is sustained now over the course of the next decade and then on over the following decades to make sure that we're really where we want to be as a country and not lagging behind the rest of the world in quality dementia care.
What is the role of the Dementia Collaborative Research Centres and why were they established?
Well, the Dementia Collaborative Research Centres fit within the rubric of what's called the Federal Government Dementia Initiative. And the Dementia Initiative has a number of parts. Some of it has to do with supporting people living at home with dementia, which is not research specific, and that is things like the EACH packages that people receive so that they continue to be cared for and remain in their homes. And then there are dementia behaviour management advisory services, the National Dementia Support Program, and then there's a set of grants and research support monies. Some of this is funneled to National Health and Medical Research Council dementia-specific grants, and another large part of this since 2006-2007 has been funneled into the Dementia Collaborative Research Centres. There are 3 centres, and the purpose of the DCRCs is to undertake really 3 activities. The first one, obviously, is collaborative, high-quality research that's going to create new knowledge which can be used to improve aspects of the dementia experience for people with dementia and their carers. And the second one is training of the next generation of dementia researchers in Australia via scholarship support and research mentoring and opportunities to really be embedded within the dementia research community in Australia and internationally. And the third is the funneling of the research findings, not just from our research, but from research in many other international contexts, to the stakeholders, to people with dementia, to their carers, to health professionals who are involved in caring for people in all sorts of settings, from the community right through to residential care and across the entire trajectory of this disease, into practice so that people actually know that they're using the best evidence there is for whatever it is that they're doing to improve quality of life and quality of care. So with those 3 aims in mind, the 3 DCRCs were funded, And each DCRC has a specific focus where their research is actually geared. So the DCRC here, which is called Carers and Consumers, as you said, is focused on quality of life and quality of care for people with dementia and their carers. And this is a very broad focus, but it allows us to do research where we are looking at what can we do better in improving the daily lives of people who are dealing with this disease.
What are the primary projects that are currently being undertaken by the DCRC?
Well, let's start with DCRC, Early Diagnosis and Prevention. This is the centre in Canberra, but it includes a wide range of investigators from across Australia, and the director there is Dr. Karen Anstey. They have two broad streams of research. One of them is research which is designed to look at a number of the biological, physiological factors that are known to impact the development of Alzheimer's disease and other dementias. Another stream that they are involved in has to do with risk reduction and risk assessment. And what is it that we can get people to do that will actually tell them what their risks are and what they can do about them. And then looking at some evaluation research that tells us whether or not these projects that we're doing are actually resulting in behavioural change. So that's that DCRC. DCRC, Early Diagnosis and Prevention, has a very, very broad program of research, but two of the important things that are coming out of that DCRC, one has to do with general practitioners and upskilling general practitioners to understand much, much more about dementia and to be able to work with practice nurses to better identify people presenting in general practice offices and finding out whether or not they have a memory problem and assessing them properly and making sure that they get the best assessment and care and treatment. There's other projects in the areas of special interest groups that fall under the dementia umbrella. So we're talking there about people from Indigenous backgrounds, from people from culturally and linguistically diverse backgrounds, and people who have early onset disease. And then in our DCRC, we're talking about caring and consuming, we also have a range of projects that cover things as diverse as what's going on in residential aged care in relation to sexuality and sexual expression by people with dementia. The issue of sexuality and sexual expression is really the elephant on the table in many of these environments when people are making decisions about living arrangements and about how staff need to interact around issues as controversial in some contexts. There's a growing interest around the world in alternative therapies for people with dementia, particularly therapies that help us with dealing with dementia-related behavioural symptomatology. And one of the things that has gained some recent traction is the use of robotic animal therapies. Prof. Wendy Moyle from Griffith University and myself here at QUT will be testing this to see if it does have an impact on agitation and anxiety levels in people with behavioural symptoms who are living in residential aged care.
Great. In what ways are dementia carers and people with dementia involved with the research in the DCRCs?
Well, this is a exciting and challenging area for us because obviously one of the complaints that's always made, I think, about research is that it sometimes seems to be very detached from reality and detached from people's everyday lives. And we're fortunate in Australia to have a very strong peak body in Alzheimer's Australia, and that is why we have now a new quality dementia care network in which consumers are able to come together and work within the framework of the Dementia Collaborative Research Centres along with researchers. Now, this is a very new formalised enterprise for us. So clearly what's been going on for a long time in dementia research is that people with dementia and their caregivers have always been research participants, and that will continue. But one of the things we're trying to do in this joint enterprise is work with consumers to understand much more about what their felt priorities are and what sorts of information and support that they need to help them feel that they're able to offer or have access to the best therapies available, the best quality of care available, and to do research which they feel is important and will make a difference to their lives.
And finally, you're speaking at IIR's National Dementia Congress taking place on February 21 to 22 in Melbourne. What will be the focus of your presentation?
Well, what I've been asked to do is to give an overview of the Dementia Initiative, specifically the work of the Dementia Collaborative Research Centres, to highlight research that's been done in the past and where people can access that and what it's telling us, so to give a summary of some of those major things, and to walk you through some of the current research that is being done and some of the early findings that's coming out of what we've been doing, and really to answer questions from people about the scope and intent of what we're doing and how they might be able to become involved should they have an interest, and where they can find the results and the information that we're actually being able to produce.
Great, thanks for joining us, Elizabeth, and we look forward to seeing you in Melbourne in February.